Hello, students. Good morning to all of you. So, in this lecture, we will study the community diagnosis and the treatment. So, before moving to the actual topic, that is community diagnosis, you should know what is community. So, community is defined as a social group that is determined by geographical boundaries and our common values and interest. Now, the objective of community diagnosis. The first objective to determine the priority health needs of people and resources to meet these needs. And to elicit community participation. These are the two objectives of community diagnosis. Now, the steps involved in community diagnosis. The first step is listen to people, their chief complaints or demands. That's the first step. And the second step is observation on community. Third is investigation in community. And fourth is tentative diagnosis. Fifth is final diagnosis. And then treatment of community. Then follow up of community. Then evaluation of treatment or therapy. And finally, replanning of services. So these are the 9 steps involved in the process of community diagnosis. Now, in the coming slides, we will discuss each step in detail. Listening to people, their chief complaints or their demands. The public health approach puts people first. People express their felt health needs in the forms of demands. The experts determine the real health needs based on scientific evidence. So begin with areas where there is an overlap of health demands, that is felt needs, and the real needs. And in the second phase, we can focus on the real health needs that are based on scientific evidence. The second step is observation and community. We can observe the geographical area to be covered, terrain, roads, and accessibility of areas, the size of population to be served, number of villages, households, and families, number of sub centers, health staff in position, resources available in terms of village health and sanitation committee, ashas, anganwadi workers, schools, village panchayats and their members, private practitioners, and NGOs. Properly assess the sanitary conditions, sources of drinking water, excreta disposal practices, health practices, major occupations, leadership pattern, community organizations, cropping pattern, health customs and practices, health seeking behavior, as also age and sex composition of population, in terms of sex ratio, infants, preschool children, school age, adolescents, eligible couples, and elderly populations, etc. The third step is examination of community. It consists of examination of health services data, health records, and reports of sub-centers, primary health centers, as also surveillance data such as number of pregnant women, birth and deaths, and disease occurring in the area, causes of deaths, OPT record for common morbidities in the area, coverage of children for immunization, and eligible couple for contraceptive services from integrated RMNCH plus A register. The next step is surveys and investigation in community. The annual household survey and eligible couple survey and their regular updates provide a wealth of information on number of beneficiaries and in which household these beneficiaries are located. Healthcare utilization can be worked out. Household survey data provides information on age and sex of all members, their marital status, literacy level, economic status, source of drinking water, use of sanitary latrines, excreta disposal practices, and cooking fuel, which form the basis of health needs assessment of each and every household and community diagnosis. Investigation consists of water samples testing for coliform count, stool examination, blood smear examination for malaria, dietary survey, mass fever surveys, outbreak investigation, population-based screening of risk factor for non-communicable diseases by point-of-care tests, sputum examination for TB, and testing of salt sample for iodine content. On the basis of these steps, we can make a tentative or a final diagnosis of the community. Now, the community therapy or community treatment. It includes two steps. One is the prescription or treatment of presenting illness to reduce disease, incidence and mortality or disability. The second is treatment prescription for treatment or prescription for determinants or underlying causes of presenting illness. Now the follow-up of community. Follow-up of community in their homes or at a clinic at subcenter and PHCs is essential to motivate people to continue the treatment or prophylaxis, to complete the immunization, space birth at least 3 years apart, early breastfeeding, and universal exclusive breastfeeding. Then the evaluation of therapy or interventions. The impact of intervention or services can be assessed by monitoring of activities through annual reports, annual household surveys, and rapid method of assessment by eliciting client satisfaction, reduction in malnutrition, birth rate, a reduction in morbidity and mortality, reduction of anemia and malaria incidence, etc. On this basis, we can evaluate our interventions that we have done in the community. The final step is replanning of services. The results of evaluation can be fed back to the system to fill the gaps and improvement of organized health services. So this was all about the community diagnosis. In the coming lecture, we will move toward the family studies, different types of families, how and how you will proceed for complete family studies. Thank you.